talking about some of the exercise-based principles because years ago, decades ago, thankfully, they used to say that pregnant women should not exercise. We have since been able to scientifically prove that that is false. We do encourage our pregnant mamas to exercise. Now, there are certain medical conditions where we do not want mamas exercising because it can place mom and or baby at risk. And those are conditions that can lead to something such as preterm labor. And preterm labor is defined as anything that occurs before 37 weeks, okay? However, there are still some moms who, as long as their doctor clears them, then they are still good to go. Even with certain medical conditions, they just have to take extra precautions. So certain things that we would say you might want to talk with your physician for before trying to exercise or when you have an incompetent cervix. So meaning the cervix itself is shorter and that can lead to preterm labor. A lot of times they're put in a cerclage so that way they can kind of help close off the cervix. And a lot of those women, not all, but a lot of those women are placed on bed rest and restricted activity. Now, if you are someone who has preeclampsia, then exercise is likely not the best option for you. You more than likely are being monitored for your blood pressure, and they will tell you exactly how you need to adjust for certain activities to make sure both you and baby stay safe. Now, preeclampsia is generally characterized by elevated blood pressure, but it does have other symptoms as well, because it is possible for some moms to have high blood pressure prior to pregnancy. And we do want for them to continue to exercise with their physician's clearance and making sure that mom and baby are safe for that reason. But we do want for them to maintain a healthy lifestyle with exercise. So when it comes to exercise, people always ask me, what type of exercises can I not do? Well, my big ones I tell you not to do is I don't want you exercising at certain elevations if your body is not used to that. So if you're not used to exercising in the mountains, you may want to consider how that can impact your body because you will have decreased oxygen available. And you may notice that you're feeling a little bit lightheaded compared to what you would at sea level. Also, you should not go scuba diving. That one, a lot of people are surprised that I say, but I've had people try to go scuba diving. So yes, if you're pregnant, you should not go scuba diving. It's typically advised that you avoid contact sports when you are pregnant, just because of the risk of mom potentially falling and or getting hit in the belly with for the baby. So it's generally advised you do not participate in contact sports. There are some high-level soccer players who I know who have played while they are pregnant, and my advice for that is to make sure you follow the advice of your physician, so that way you can make sure that both you and baby stay safe. Now, is running safe? Yes, running during pregnancy is safe. Is lifting weights safe? Yes, lifting weights during pregnancy also safe. Pregnant moms can go swimming. Pregnant moms can walk. They can generally participate in most of the physical activities that they were doing prior to pregnancy. Now, when you are pregnant, this is not the time where you're trying to make personal best, set those records, and also go for the different gains as far as you lifting, running, whatever activity you may be doing. Pregnancy is a time for you to focus on maintaining. So that also may mean that you may need to decrease your resistance or your weight with certain activities. Working with some CrossFit moms, sometimes we have to cut back the weight a little bit, or sometimes we have to modify the number of sets. When you are doing some type of like endurance-based activity, when it comes to running, you may need to decrease the mileage that you're doing. You also may need to just give yourself more grace because your times may not be as fast. So you're still able to do those activities just with certain modifications that you may not have to consider had you not when you were not pregnant. All right. So those are the big things as far as what you can and can't do with exercise. But that doesn't tell you how to keep yourself safe during exercise. Some women do monitor their heart rate when they're exercising. Depending on the fitness level of mom, that can be a good measure. However, for some moms who are in extremely good shape, they may not notice a big change in their heart rate as compared to others who are not. So that may not be the best way to monitor. Some women will monitor their blood pressure as well. Blood pressure can be a good indicator as far as how well you're exercising and also how well you're recovering. Blood pressure is also a good thing to check just in general with pregnancy, especially after 20 weeks, simply because of the risk of preeclampsia. So do keep that in mind. There are different organizations that also give out free blood pressure cuffs or discounted blood pressure cuffs for our mamas who may need them. When it comes to exercise, if blood pressure cuff or monitoring your heart rate is something that you cannot do, I tell my women something very easy that you can do is the talk test. When it comes to the talk test, If you are performing an activity at a moderate intensity, which is what is recommended, a moderate intensity based exercise, then you should still be able to talk. You may be a little winded, but you still should be able to talk and hold a conversation. Now, if you're performing an exercise because you're all out sprinting and you're breathing so hard to where you can't talk, that is definitely a maximal or higher intensity. So staying towards the moderate intensity level for most women tends to be safe. Now, if you're someone who's been conditioned and trained to work at higher intensity, make sure you go within your parameters that you're comfortable with as well. If you are exercising, I'm going to make sure that you get a little exercise card via email that you can kind of keep in your pocket or keep in your purse or wallet, so that way you can refer to it. And there's going to be something called the rate of perceived exertion chart up there. And it will give you numbers. That way you can rate somewhere between 0 to 10. How hard do I feel I'm working out? And we want you to stay around 5 to 6 and potentially going up to 7, depending on the workout that you're doing. It will let you know of the intensity level of your workout, and also will have the reminder on that little card that you're going to get via email saying, if the talk test, if you can talk, but you're just a little winded, that is a good intensity as far as it being moderate intensity. Now, if you cannot talk because you're so winded, higher intensity, and you probably won't be able to do that activity as long. Awesome. So just some different ways to help monitor how you're feeling during exercise. But what are you going to do? Or how are you going to know if something is wrong? That's probably the most important piece, because when it comes to something being wrong, we want to make sure that you are taken care of and that baby is taken care of. So just some different things you should be mindful of. If you're having shortness of breath prior to completing or prior to starting exercise, then that is not the time for you to exercise. We want to make sure that you're not having a shortness of breath prior to starting exercise. If you're noticing that you're having headaches, blurry vision while you're exercising, I want you to go ahead and stop. Also, if you're noticing you're having chest pain, that is the time for you to stop as well. If you're having any type of vaginal bleeding in response to exercise, please stop the exercise. If you feel a gush of fluid from the vaginal region, same thing, stop. These can all be indications that you need to contact your physician, especially if you're having bleeding, the gush, shortness of breath while you are exercising that is not related to the exercise, chest pain. I want you to contact your physician. Now, there's one that can be a little tricky, and we went over this a little bit last week as well, and that is Braxton Hicks. Because if you're noticing contractions or tightening of the belly, I want you to stop exercise. The contractions that you may be feeling could be false contractions and could be Braxton Hicks. And if that's the case, then you taking rest and you drinking water and changing your position can help with that. However, if you realize that what you're feeling, the sensation that you're feeling is not improving with you taking rest, drinking water, and changing position, there's a chance that you may be having contractions. And I would like for you to contact your physician immediately just to make sure to see if they want you to come in. So those are some of the big things and big warning signs when it comes to exercise. Something that women don't often consider, and even some physicians don't consider when you're exercising, is if you're having pressure or pain, it may be a warning sign that we want for you to stop. And not when I say stop, I'm not saying stop altogether, but first try modifying the activity and let's consider what type of pain that you're having. Because if you're having back pain while you're exercising, it could be that you're not properly activating your core. If you're having pressure down in the vaginal region, it also could be that you're not activating your core properly and getting too much pressure pushing down on those muscles. So sometimes learning how to properly modify your activities and also how to properly activate the core when you're doing certain things can be extremely helpful, okay? So making sure, are there any questions with that? All righty. So what do you need to do to prepare for exercise? First thing I want for you to do as you prepare for exercise is to eat. Please make sure that you're eating at some point before exercising, okay? Some women will wake up first thing in the morning after they've been asleep all night, whether somewhere between 6 to like 10 hours, depending on how much you're sleeping. We should be getting 7 to 9, just in case you didn't know, you should be trying to get 7 to 9 hours of sleep. But the point is you're waking up and your body is in a fasted state. What that means is that your body has not consumed food in a certain amount of time. So now the energy stores it has are going to be a little bit lower, and it may pull from areas that you don't want it to pull from. So please make sure that you're eating 1 to 2 hours before you go to exercise. Also, make sure that you are staying hydrated. Hydration is key. And I do want to make sure I say this as well, especially if you're in a warmer climate, hydration is key. When it comes to pregnancy and hot and exercising in hot environments, they generally don't recommend it. So if you're a hot yoga fan, it's generally something that's not recommended because mama can easily overheat. And mama can overheat even easier if she's dehydrated. So please make sure you are hydrating. You should be sipping water throughout the day. And a way that you can tell that you are well hydrated is simply looking at your urine. It should be a light pale yellow color. If it is a darker color, that means that you need to get more fluid in, preferably water in. If it's extremely pale or really clear, then there's a chance that you may be getting a little bit too much. But before you cut back, make sure that all your lab values with your doctors look okay, because as long as your electrolytes look okay, then you can continue with the same amount of water you've been consuming. So general rule of thumb, a lot of times you'll hear people say, oh, you should get about 8 cups of water a day. And well, right now, there's really no true scientific evidence backing that up. So I tell my mamas and pretty much everyone I see, you want to try to aim for half of your body weight in fluid ounces to start with. Now, during pregnancy, you may need a little bit more than that. So let's say during pregnancy, let's say before you were pregnant, you were around 120 pounds. So that means you want to aim for at least, you want to aim for 60 ounces or 60 fluid ounces, with most of that being water. Now, as you're pregnant, we know we gain weight. So your body is changing. Also, the body composition is changing. You're going to need more water than that. So before, if you were only getting 60 ounces, then now you're probably going to need more. So starting off first, taking your body weight, dividing it in half, and using that as your fluid ounce that you want to aim for. Sipping throughout the day, okay? Sipping throughout the day. What else can you do to prepare for exercise? You can also do an easy warm up. So if you're someone who likes to run, your warm up may consist of you doing a lighter jog or even a walking pace. If you're someone who's walking, your warm up may consist of you doing a simple like a bounce in place, or even starting off at a slower walking pace. So warming up can be key to help prepare your body and help prepare your muscles, so that way you're able to get into the exercise safely. Now, I know there's some women who have questions as far as how long should a warm up be, and that's specific to the activity that you're doing. The biggest thing we don't want you doing is jumping up from not doing anything to immediately trying to go run. So even if you're walking for just a couple of minutes, that can be enough to help your body prepare to continue that exercise. Okay. Any questions so far? All righty. So this is probably the part that you all have been waiting for. We're going to do a mini mama workout. And with some of the modifications that we have, we're going to address those. I'm also going to address some of the pain components, because during pregnancy, it is common, not normal, but common for women to have lower back pain, to have pain like in between their pelvis and where their spine combine at the SI joint. It is common for women to sometimes complain of pain at the front of the pelvis as well. So right through here, the pubic symphysis, back through here being that SI joint, and also the back, which would be through here. It is common for mamas to complain of hip pain. It is also common for mamas to complain of round ligament pain on the front side, the lower abdominal region. So we're going to go over some different things that can help with that, because a lot of those can respond very well to stretches and also to proper strengthening activity, okay? So when it comes to pain related to the pelvic region and also to the low back, a lot of times we're looking at doing proper core strengthening and also proper hip strengthening. The proper core strengthening and hip strengthening are good for the pelvic region, including the front of the pelvis if there's pain there at that pubic symphysis, the back of the pelvis at that SI joint, the low back, and the hips. And there are some times where the same strengthening activities can help with round ligament pain. When it comes to round ligament pain, there are some mamas who will notice that they feel better in certain positions. So they don't like transitions well. So if they're sitting and then they go to stand, sometimes they'll get like a sharp jolt or a quick pain in that lower abdominal region. So even learning how to better support the belly when you're going to stand, simply using your core muscles or your hands, can be very beneficial. So first, let's learn how to activate our core so that as we do some of these activities, so that way, when you're doing exercises, if you're noticing you're having pain, you can gently activate some of these muscles a few times and then relax off. Because one thing I don't want you doing is I don't want you trying to activate these muscles for the duration of your activity, okay? All righty. So we are going to find, I'm going to come to the top of my hips and I'll show you on the pelvis as well. Coming to the top of my hips, I'm going to look for this little nodule, this little knob right here. So to find that at the top of my pelvis, I'm going to drop down and I'll stand up a little bit closer to the camera so you can see. I'm going to drop down to where I feel in the front like a little knob. All right, and with the pregnant belly, it's going to be a little bit harder, but that is okay because you'll be able to see movement that I won't be able to see. But what I'm going to do is I'm going to tell you without holding your breath, I want for you to gently pull your belly button in. And my pregnant mamas, you'll notice that your belly kind of lifts up a little bit. And as that belly lifts up a little bit, you are helping to offload that pelvic floor. You are helping to offload some of that round ligament pain. And you're also helping to offload the hips and the back, okay? So that little gentle motion itself, where you're just gently pulling the belly button in, that could be something that you do as you're going through activities. Even watching your posture, because we get stuck when we are pregnant, we get stuck here because the belly is pulling us forward. So instead of being stuck with the extra arch in your back, I want for you to stack so that way you have your ribs on top of your hips. So that's something as simple as rather than letting the butt poke backwards, you're just going to gently rotate and bring the hips and the pelvis underneath you, okay? And as you do that, you will also notice that that muscle we just found to help lift the belly, that muscle activates a little bit. So even just doing that, going from here, fixing your posture can help activate that muscle, okay? All righty. So keep that in mind as we're going through different activities. So that way you can make sure that if you're noticing any pain, you can see how you're responding and how you are feeling. At the end, we're going to go through some stretches as well that can help with some of the different pain areas that we mentioned, okay? All righty, so let's bring it up to standing. We're gonna start off first going over some different things that you can do in a standing position for our mini mama workout. And one of the precautions I had was for someone who has to learn how to do modified squats. Another precaution I had for this is also someone who's limited to walking exercises, okay? So I will show you how to make modifications for both of those. All right, so first we're going to get you in a standing position. Now we know whenever we walk, we typically just have just this motion going here. And that can get a little bit boring. No one wants to do that too long. But if it's what you need to do, let's figure out how we can make it more fun and also how you can get more muscles involved, okay? So as we are walking first for our mommy workout, what I'm going to have you do is move back a little bit. I'm going to have you, as you're walking first, is bring one knee up and back down. So it's going to be a little bit slower. Up and down, so doing high knees. And now I'm going to have you bring it faster and a little faster. Don't worry, we're not going to bring it into a run at all. All righty, keep going for our mommy workout. All righty, so in just a moment, we are going to move this into a side step, okay? I'm going to count us down for that. 5, 4, 3, 2, 1, and just stepping to the side, stepping to the side. These both count as walking, okay? So I can modify the speed. I can modify how much I'm lifting my legs up. That way I'm able to maintain those precautions I have. And I'm also able to work the muscles in different ways. Right now, we're working the muscles on the outside of our hips called our glute medius. And those are important, especially if you're noticing that you're having pain in that lower belly region, if you're having pain in the hips, or even in the back, okay? So these muscles are important. All right. So for the person who I know who cannot squat, I'm going to show you how to do a modified squat because they say they don't want you doing regular squats. And we're going to combine that with this side step that we're doing, okay? And we're going to combine that in 5, 4, 3, 2, 1. All right, so now squat a little bit and back up. As simple as that, squat a little bit and back up. Now, if you don't have this modification, you are able to squat deeper, okay? You can do the deeper squat. Now, if you're someone who's limited to walking, I want you, same thing, little squat, okay? As you're doing this little squat, you also can gently pull that belly button in. And do you feel your tummy lift up? You should feel that tummy lift up a little bit. You also should feel a little bit of relief down through this region. Good. So still doing your belly squat. If you're able to do the deep squat, we're still going sideways. This is still a walking modification. This one you're able to do going up and down a curve. You're able to walk up and down sideways on the stairs, making sure that you're holding onto the handrails. That way you can stay safe. And we don't have any falls. Good. Still doing that mini squat. Almost there. We're going to count it down. 5, 4, 3, 2, and 1. Good. So some of our walking modifications. For our next walking modification, I'm going to turn this way. That way you can see me, okay? Walking. We're going to do first just our regular walking. And now we're going to add in a kick with our walk, okay? So whenever we say here walking, people always think we have to go walking outside. You can even walk stationary and add this into what you're doing at home. But let's get more of the body involved. So each time I kick, now I'm also going to move my arms forward. But notice, I'm not just, lightly pushing my arms forward. I'm pushing my arms forward with a little bit of force, okay? As we're doing this, we are gently activating our core as well. If you need to take a break at any point, please take your break. We're going to keep kicking, but we're going to switch the position of our arms. We're going to move our arms overhead now. Still walking. And for my mamas who are able to, if you are limited to walking, I want you to stay here. My mamas who are able to, I want for you, we're going to make it a little bit harder, okay? So you're going to squat kick, squat kick, squat kick. Okay? Any point you need to take a break, please take a break, grab water. Good. And bringing it back down to walking. So some easy modifications that you can do. We're incorporating walking, okay? Incorporating a light squat. And even then, there's one that I like. I'm not going to make you do it now, but I just want you to keep moving, keep your heart rate where it is, so keep walking. Well, when you are walking forward, you can take a break and squat and keep walking and squat and keep walking. Because every time you go to get in and out of a chair and on and off the toilet, you're squatting. So this can at least help with that and also continue to condition your body, okay? All right, so we have your heart rate elevated a little bit. We're going to bring you down to the ground on all fours, okay? I am not going to be doing any exercises with you all on your backs because when it comes to pregnancy, there are some instances where we don't want pregnant women on their backs when they're beyond a certain time frame, especially as the belly gets bigger, because they can decrease the compression itself of a major vein. And we just want to make sure blood flow is okay. It is generally safe for women to be in that position for a short period of time, but not for an extended period of time. But just to help decrease any issues, we're not going to do anything tonight on your back. If you decide to exercise on your back, you can also use pillows or a wedge underneath you to help elevate the shoulders and the head a little bit, so that way you're not getting that same compression, okay? But I'm going to bring you to all fours on your knees. Once you are here on your knees, I'm going to have you do that belly button pull that we did. So pulling the belly button in. And now I'm going to have you bring one arm up and back down. And the other arm up and back down. Now, if that is too easy, you can combine it with the next motion I'm going to show you, okay? But first, let me just show just the modification. We did the arms, now we're going to do just the legs. So now you're going to bring one leg up and back down, and the other leg up and back down, okay? If now, both of those, like I said, if those are too easy, you can combine them to one arm, one leg. Notice it's my opposite arm, opposite leg, and back down. As you're doing that, try to keep the back as straight as you can. We don't want you to arch like I'm arching right now, but try to keep the back as straight as you can. So we're just keeping the belly button pulled in, arm and leg up and down, belly button relax, pull the belly button in again, up and down. Good, and we're going to do that one there a few times, okay? So if you need to stick with the arms first, that is fine. We're going to go up with the arms and then down, and then up with the leg and down, okay? All right, so let's alternate. We're going to bring one arm up. Good. The same thing on the other side. And notice I'm only holding for about a second, but you're keeping that belly button in when you bring the legs or the arms off the ground, but you can let it relax in between. Good. All right, good. We're going to do 2 more on each side. If you need to take a break at any point, please do. Good. All right. So next thing we're going to have you do, we're still in this position, okay? In this position, we're going to keep the knee bent, and we're going to have you kick one leg up and down. Kicking my leg up as if I'm trying to kick this heel. Now notice my back isn't arched like this. I'm trying to keep my back straight and down. Bringing the leg up and down. And up and down. Good. Take a break if you need to. Even if you can't get the leg all the way up, coming here is great. So do the best that you can just to move. We're just trying to get the hips stronger to help support the weight of the growing baby. And also strengthening will help you during labor as well. All right, let's switch over to the other side. Good. We're going to do 4 more on this side here. Good. Almost there. Here we go. Perfect. All righty. Now we're going to get you laying onto your side, okay? With you here on your side, I'm going to have you keep your knees bent and your feet together. In this position, you're going to leave your feet together. The knees are going to move apart. So the top knee is going to come up, and I'm going to have you hold for 3, 2, 1, and down. All right, good. We're going to go up again and holding for 3, 2, 1, and down. Now, when I say hold, I mean just hold just the leg. Please don't hold your breath, okay? And up, 3, 2, 1, and down. Good. And going up again, 3, 2, 1, and down. Good. Going up, 3, 2, 1, and down. And going up, 3, 2, 1, and down. One more, and up, 3, 2, 1, and down. Good. That one here, you should feel kind of on the outside of the hip towards the buttock region. That one is going to be really good to try to help with any pain that you're having in the back of the hips and even some of that round ligament pain, because it can help give you more stability at the pelvis, okay? All right, so the next thing I'm going to have you do is to take your hand. You're going to place your hand in between the knees. And I'm just going to have you just gently squeeze your knees together. As simple as that. This one you can do sitting down as well. And you're just going to squeeze the knees together and then relax. There's 2. We're going to go for 10. Squeeze the knees together and relax. Squeeze the knees together and relax. There's 4. Squeeze the knees together and relax. There's 5. And squeeze and relax. Now, when you relax, make sure you relax all the way off and squeeze and relax. And squeeze and relax. And squeeze and relax. Good. 2 more. And squeeze and relax. 1 more. And squeeze and relax. Awesome. All right. So we did this hip for our clamshells, but we need to do the other side. We're not going to do the squeeze again with the knees, but we're definitely going to do the other side for the clamshells, okay? It's going to bring you up and around, swinging the legs around. Good. And coming down onto the side, keeping the feet together. The top knee is going to come up, and we're going to do a 3-second hold again, and going up and holding for 3, 2, 1, and down. Good. And going up, 3, 2, 1, and down. Make sure you're not holding your breath. And going up, 3, 2, 1, and down. And up, 3, 2, 1, and down. Good. 3 more. And up, 3, 2, 1, and down. And up, 3, 2, 1, and down. Last one. And up, 3, 2, 1, and down. Perfect. All right. We're going to go over just a few stretches that can help as well with some of the pain that we talked about. And these will be really good for the hip pain we mentioned, the back pain, round ligament pain, the pubic pain that you may be having. So that way you can help manage your symptoms independently, okay? So the first stretch I'm going to have you do, you're already partially in position. I'm going to show you 2 versions of this stretch because it just depends on your flexibility and your comfort level. And I want to make sure that you are comfortable while you're doing this. So first version of this step, I'm going to have you bring the legs in front, and I'm going to have you cross one foot to the other opposite side. As you do that, I'm going to have you gently just pull the knee towards that opposite shoulder, okay? So, and I'll switch my legs, that way you can probably see better on the camera. So I'm going to be feeling the stretch through here. So I'm bringing my left leg across my right side. My right arm, my right hand is going to pull that left knee towards my right shoulder. And I'm feeling that stretch through here in the left buttock region. So this here can be used to help stretch a muscle called your piriformis. Now, if you feel a good stretch here, please don't feel like you have to try this next one. It's because there's some also depending on how far along you are in your pregnancy, this one may not be as comfortable, and we can modify it as well with the next for the next stretch. But same, you're stretching same muscle. I'm going to bring my right leg up now, and now my left leg is going to cross over with my ankle where the knee is. And depending on the belly, you may need to lean back a little bit, but you can also push that knee down. And with this one, you'll feel that stretch, similar area through here for that piriformis muscle, okay? So you can either do with one leg on top of the other, as far as me bringing my foot over towards the knee, or you can stick with this one here, okay? And now we're going to hold that stretch for just a little bit. And we're going to stretch out the other side. Now, stretching should not cause numbness or tingling. If you're noticing numbness or tingling, I want you to ease up on the stretch and or change the position that you're doing. Stretching also should not cause significant pain. It should be a little bit of discomfort just because you're stretching the muscle, but discomfort and pain in this case are different, okay? So I want to make sure if you're having pain, just like I told you with the exercises, please modify and stop if you need to. All right, let's go over to the other side. So now I'm going to stretch out my right hip. I'm going to bring let my right foot up and around on the other side of that left leg. And now I'm going to use my left hand to pull my right knee towards my left shoulder. And I'm going to be feeling that stretch in the right buttock region. And we're just going to hold here, okay? So same thing I just told you. Some light discomfort is expected with stretching, but it should not be painful. If you're having pain, I want for you to modify. The modification is not helping as far as you decreasing the stretch amount. Then I want for you to stop, okay? I will hold this one for just a little bit longer. Good. All righty. So the next one I'm going to have you do is a very common one. Bringing the feet in front of you. I'm going to have you bring the knees out to the side, and you're just going to allow for those knees just to come down towards the ground, and you're going to feel that stretch here on the inner thigh, okay? Do not force stretching. You should notice when you're starting to feel that stretch and that tension, do not feel as if after you have to go beyond that point, okay? Because that can result in injury. We want to make sure that you're staying safe and that you're not getting hurt while you're stretching, okay? And we're just going to hold here for a little bit. So we're stretching out now the adductor muscles. They connect to the pubic bone. The pubic bone is the bottom of your pelvis. So we just want to make sure that we're stretching this area out. This also can be very beneficial as far as helping to stretch and relax the pelvic floor as well, okay? And when it comes time for labor, you want for that pelvic floor to be able to relax. Yes, as you're carrying baby, we want the pelvic floor to stay nice and strong. That way it can give you the support below. But during labor, we want to make sure that your body knows how to relax as well. Perfect. All righty. Now from this one here, I'm going to have you go into a kneeling position. So we're going to go into all fours first and then bring one leg forward. So in this kneeling position, I'm going to have one leg forward now. So we're in a half kneel. The back leg, we're going to stretch out the front of the hips. If you are someone who has round ligament pain, this one may actually be very helpful for you because that round ligament is going to run the lower abdominal region. I'm going to have you for the leg that is in front. Right now, I have my left leg in front. My right leg is down on the ground. I'm going to gently lean my body weight in towards that left leg. As I do that, I'm also gently squeezing my right butt. That way I can get a good stretch through here. And we're just going to hold this here for just a little bit, and then we'll switch over to the other side. Same thing, if you're noticing pain with this, I want for you to modify and or stop if you need to. Some discomfort is expected, but I don't want for you to have pain with this. And if you are in the midst of having any type of pain, I want you to give these stretches a try to see how your body responds to it. So that way you're still able to do the activities that you like. Because pain doesn't necessarily mean that you should be put on bed rest or shouldn't do certain things, but sometimes your body is telling you, hey, I need a little bit of support. So I also encourage you that if you're noticing pain during pregnancy, seek out a pelvic floor therapist. That way we can make sure we're giving you the tailored treatment that you need. Because sometimes things that you need may be different from someone else, but these are just some general recommendations. All right, let's switch over to the other leg. So we're going to bring the left knee down to the kneel. And now my right leg is going to come forward. I'm going to lean my body weight into my right leg, feeling that stretch on the left side, standing, squeezing my left butt cheek. Good. And make sure you're breathing. Please don't hold your breath. Yeah, we want to make sure that you are breathing. Holding your breath with some of these things can make your blood pressure go up, and that's not what we want. It also can make you feel a little lightheaded, so please make sure you are breathing. If you need to also stop and hydrate, get some water, do that as well. Good. All righty. We're going to go one more time onto our hands and knees. And now we're going to go here in this position here. We're going to do a common stretch called cat camel. With this stretch here, we're going to allow for the belly to stretch out on the bottom. It's the same thing, round ligament pain is going to be helpful. We're also going to allow for the back to round up like a cat, so that way we can stretch out the back area as well. So this one is good for hip pain, back pain, round ligament pain, and any type of pelvic pain as well, okay? So only thing I'm going to do is I'm just going to gently push my chest and my tummy down. I'm going to look forward, slightly up. And we're just going to take just a few breaths here. So I'm probably going to take 3 breaths. And one more breath. Good. And now on this exhale, I'm going to curve my back the other way. So pushing my back up towards the sky, tucking my bottom underneath. And we're just going to take a few breaths here as well. Good. One more breath, and then we'll do each direction one more time. And now exhaling, bringing our chest and our back down, pushing our bottom up towards the sky, looking forward slightly up. And remember, with everything that we have done, if you're noticing any of the exercise stop signals I told you, please make sure that you're abiding by those. Listen to your body. Good. And now pushing the back up, tucking the bottom under. Last time here. Perfect. All right. You can go ahead and sit in any position that you are comfortable in, okay? And